NCAER's series of webinars about the coronavirus. This is the second in our series. The first one was last Friday. And in that first one, we looked at work that colleagues at the University of Michigan have been doing on epidemiological models of the coronavirus. Much closer to home, NCR itself has been working at great speed to do a rapid telephone survey of households in the Delhi National Capital Region. And we are just delighted to have three NCAER colleagues with us who are going to talk about the survey, the results, the findings, and some of the implications. And we are very pleased to host them on this webinar. With me is Professor Sonalde Desai at NCAER and at the University of Maryland, where she's a professor of sociology. She's the director of our National Data Innovation Center, which we set up some years back. And this center is designed to experiment in data collection and data innovation. And it's that innovativeness of that center that has led them to very quickly put together a telephone survey and be able to capture what we need to know about how households are coping with the coronavirus. They will talk more about the survey, of course. Sonalde Desai is a well-known demographer. She's also the leader of the India Human Development Survey, which is a survey that is a joint partnership between NCR and the University of Maryland. And this survey will itself be going into a third round later on this year, when, of course, field operations will restart. With me also is Dr. Santanu Pramanik, who is the Deputy Director of our National Data Innovation Center. He's a statistician and a survey methodologist with a special interest in public health. So it's very appropriate that he has been playing the lead role in this rapid telephone survey of the Delhi National Capital Region. And finally, with me is Dr. Dinesh Tiwari. Dinesh is an anthropologist by training, and he has a rich experience in conducting large national surveys. Those of you who know of the work of the Palanpur experiment and Richard Stern's work know that Dinesh is the anchor or was the anchor for that work. And so it's with great pleasure that we have Dinesh participating, bringing the rich experience. I said Richard Stern, that's Nick Stern's brother, but it's really Nick Stern who is the person who has led the Palanpur experiment. And so it's great to have Dinesh with his anthropological background, but also his intense and immense field experience, which has been vital for doing this survey in a very rapid period. There'll be this webinar is being recorded. Please use the Q&A button on your screen to write your questions. We will try to take as many as possible. I'll turn to my colleagues to answer them after they have made their presentation. Sonalde Desai will lead off with the main presentation, and then Shantanu and Dinesh will follow with their own observations on the Delhi NCAER coronavirus telephone survey. Over to you, Sonal.
Thank you, Shekhar. As Shekhar mentioned, NCER National Data Innovation Center is set up to experiment with data collection methods. And this was our first experience in getting into something. We tend to be very deliberative, thoughtful, and to some extent slow. And this was the first time we had to respond to something that was very quickly, newly emerging. And it has been an immense experience and pleasure to work with a phenomenal team. Although you see only 3 of us here, with us is a very large team of researchers, interviewers, and I'd like to start out by thanking all of them before I turn to my presentation. Let me do a screen share, excuse me for a second. So COVID-19 in some ways is an uncharted territory. It's something that none of us were prepared for.
So could you turn on the slideshow so that we can see the larger,
right.
please? Thank you.
Thank you for the reminder. Okay. So coronavirus in some sense has really taken us all by surprise. No one was prepared for it, least of all, I think, researchers, either public health experts or economists. Okay. And in some ways, I think India is somewhat fortunate that coronavirus arrived late on our shores and airports. So we have experience of other countries to inform our policy decisions. Nonetheless, there are no easy solutions in front of any country at all. Clearly, what we have been practicing is thinking about social distancing and ensuring that there is very little contact between infected people and general population in order to reduce the spread of coronavirus. However, it is also done at an enormous cost. Economy is immensely affected by the lockdown, which stops people from working, reduces the transportation of goods. And I think we'll constantly need to balance these two requirements. I'd like to start out by saying that there are really no good choices. Our only hope is to make a less bad choice in as much as it's feasible for all of us, and then make those choices work. And that's where the emphasis needs to be. I'm going to tell you a little bit about data that come from Delhi National Capital Region Coronavirus Telephone Survey. This survey, and Santanu will go into much more detail about the survey. So I'm just going to tell you a little bit about it briefly so you understand what's the data that I'm presenting. This is a telephone survey of 1,750 households. It's a very short survey. It's about 10 to 12 minutes. However, we do have data on these households from interviews we had conducted over the past year. So we have quite a rich background information about our respondents. The interviews took place between April 3 and April 6. It's meant to be a representative sample of Delhi National Capital Region, including districts located in Haryana, Rajasthan, UP, and some of them are as far-flung as Bharatpur and Alwar. It contains both urban and rural households. Once I finish, Santanu will talk a little bit more about the survey and its background. And Dinesh Tiwari will talk a little more about the management of survey, particularly in these difficult times. You should want to know about the quality of the data before you believe our results. So what are our key results? And I'm going to go through each of them one by one, but just to give you sort of headline results. The first thing I'd like to stress is that overall, the communication strategies that government has adopted have worked. But they do need refining, and they will continually need refining as we sort of get along over time and the virus in the world and our knowledge progresses. The second thing is I'd like to stress is that about 84% of the households that we interviewed have seen their incomes drop, but this effect has been particularly significant for informal sector workers. So as we think in terms of policies, we will need to take into account the individuals and individual households which are suffering from income losses. Our respondents also tell us that supply shortages are affecting the households, and we'll need to deal with some of these shortages as the lockdown continues. And the final thing that I would like to say is I was very, very impressed to hear about how hard people are trying to practice social distancing. And in spite of the difficulties that they experience, there remains a continued support for the lockdown. Okay, let me go through each of these one by one. Okay. The first thing I'd like to stress is that communication strategies that government has adopted seem to be working. However, we are going to need some refinement as we go along. And in particular, I think we are going to need to sharpen our focus as the virus spreads to make sure that our population understands as to when they need to seek the help. You know, first thing that we found as, excuse me. One thing we found was that we actually were not sure how many people would have heard of coronavirus and how would they be viewing it. Many of our respondents are rural respondents, and we sort of were devising questionnaires in such a way that we can kind of make sure that they understand what we are asking them. Turned out that every single respondent had heard of coronavirus. It may be that this is a national capital region territory and hence people may be more educated and more aware, but nonetheless, as far as our sample is concerned, everyone had heard about it, no probing was required, and it was universally considered highly dangerous. 95% of the respondents, when asked, taking everything into consideration, do you think coronavirus is very dangerous, moderately dangerous, or not dangerous? And 95% said that they thought it was very, very dangerous. Okay? So clearly people know what, in that much, the communication strategies have succeeded. And people seem to understand the importance of preventing the spread of coronavirus. We also asked them about what are the symptoms of coronavirus infection. And, you know, we had thrown in a few questions sort of just so that we understand that people are sort of distinguishing between things like respiratory diseases and gastrointestinal diseases. And it was clear that people understood that it was associated with a fever, sneezing, cough, and so on. What we did find, however, that there were a few key symptoms that distinguish coronavirus from other diseases like cold or flu that were not fully understood. Specifically, a focus that it's breathing difficulties are a key symptom when the help must be sought was not very clearly recognized or understood. Now, this is a particularly important issue in the context of India, where respiratory diseases are fairly common. When we did the last interview at of the Delhi metropolitan area survey, the same respondents in around October, November, December, what we had found was that about 11% of the household members had suffered from fever, cough, and cold in 2 weeks prior to the survey. That, and because there are a household has many members, 35% of the household had somebody who had suffered from an infection. Now, if all of them try to seek treatment or testing, it's going to overwhelm our system. And so we do need to find a way by which we can communicate with people when they need to seek treatment. And that may be an area in which we are going to need some improved communication strategy. Okay. We were trying to see, you know, whether there was a difference between urban and rural area and people's ability to distinguish between breathing difficulties as a sort of an important symptom of COVID disease. And we didn't see a large difference. The only area where we saw some difference was that educated people had a better sense that this was an important distinguishing symptom of COVID as opposed to people with lower level of education. But otherwise, urban-rural differences were not large, rich-poor differences were not large. So clearly, I think that this is one area in which the communication strategies will have to be refined and enhanced as we go along. We also found that messages about social distancing were largely understood. Okay? One of the questions we asked was, how can you protect yourself from coronavirus? Tell us about the ways in which you can protect yourself. And the respondents were spontaneously telling us that, you know, hand washing is one of the things, using mask, avoiding contact with other people outside the households, avoiding crowded places, lockdown, and so on. The three markers of social distancing avoiding contact with people outside the household, avoiding crowded places, and observing lockdown, about 85 or actually 86% mentioned at least one part of social distancing. Okay? So clearly the message about social distancing is also getting through. Only 12% noted all three, but that may be the way we were asking the question without prompting, and if they mention one, they might assume that everything has been mentioned. The second part that is very important for us to note is that the lockdown is accompanied by reduction in income. It wouldn't be surprising to us that, the shopkeepers and daily wage laborers would not be able to do their work and hence incomes would go down. But 84% noting an income or wage reduction is a pretty large number. Okay. Roughly about half the respondents said that coronavirus had reduced their income over the last 2 weeks very much. About 30% said somewhat, and 16% said not at all. And these 16% are largely salaried workers who were able to either work from home or take leave. Okay. If you look at sort of breakdown between who are the people who said that their incomes had dropped very much, okay, it's basically urban population had seen a larger drop in income. Farmers had actually seen a relatively lower drop in income than the casual workers, which is 75%, who had seen very much of a drop in their income. Only 5% of the casual workers said that their incomes had not dropped, not at all. Business owners had also seen significant drop in their income, whereas comparatively salaried workers had seen a lower drop in their income. Looking at people's household incomes and comparing them between the poorest and the richest, we also find a similar difference. What we find is that the poorest had seen most significant drop in their income, where the richest had seen actually the lower drop in income, and about 26% of the richest quintile said that they had seen their incomes drop not at all. Okay. So clearly, what we are seeing is that income declines are hitting people and they are affecting the poorest more than the richest. Something, again, we need to think about as we sort of move along in devising policies for mitigation and support for some of these most vulnerable households. Migration, which has received tremendous attention in the media and in our public discourse, actually did not seem to be a major issue in this particular survey. Only about 3.4% of our respondents said that someone in their household had to move from one place to another due to the situation arising from the coronavirus outbreak. Now here I treat our data very, very cautiously. Okay. First, 3.4% of Delhi NCR region is still a very large number. But the second is that it may be because of the sample that we are using. It may well be that the migrants are the people who are stuck in between and are the people we haven't been able to interview. We interviewed 77% of our respondents, but the people who have been missed out might well be the ones who are migrating. And so this is something I would take sort of with a great deal of caution, but we felt like we should report these results. The third question, third issue that I want to emphasize is that there are supply difficulties are emerging, and it is possible that this might get worse over time. About 29% of the households responded that they were affected by some sort of supply shortage. And let me get into a little bit of a detail on that one. Basically, what we had asked, our question was, at any time in the last 2 weeks, did your household experience any shortages of food items, cooking fuel, or medicine? And what we found was that overall, 29% noted that they experienced some sort of a difficulty. And these difficulties are much greater in rural areas than in urban areas. And they seem to be affecting the poorest more than the richest. Partly because the poor people tend to buy items in small quantities, they don't tend to stock up. They may need to go to shop frequently, and both getting to the shop and supplies at the shop might be difficult for them to obtain. Okay. We asked them, people who said that they had supply shortages, we asked them, what are the items for which you experience any kind of a shortage? Okay. And what we heard was that the biggest amount of shortage that was experienced was around vegetables and fruits, a little bit lower on grains, cereals, etc. 9% of the respondents said they had hard time obtaining medicines. 8% had difficulties obtaining cooking fuel, 6% milk, 2% eggs, meat, and fish. I should note that individuals could experience more than one item. So, you could be short of both grains and fruits, and those multiple choices were allowed in this particular survey. Okay. 29% is a substantial minority of India, or at least the NCR region, and it's possible that as time goes along, this supply shortages might get bigger unless we can take some steps to ameliorate them. Finally, okay, we also found that in spite of all of these difficulties, the respondents were supportive of continuing in lockdown for an additional 2 weeks if necessary. Remember, these questions were asked between April 3 and 6, way before the current announcement by the Prime Minister today. What we asked them was, according to you, what is the chance that you or your household members will get infected with coronavirus? Okay. This was an important question for us, because while people understand the dangers of the virus, the question is, how likely do they think that they themselves are likely to get infected? And we found that people actually considered the risk of their own infection to be very low. About 63% said there was no chance they would get infected. 23% said that there was a very low chance they would get infected. And only 5% said that there was a high chance that they might get infected. Okay. So individuals think it's a dangerous virus. They think that there is a very low chance they get infected. Then the question is, do they still support the continued inconveniences that are associated with loss in income, supply shortages, and continued lockdown? Okay. We also find that social distancing is not as easy for Indian households as we might imagine. Okay. We asked the question to people how much social distancing they were practicing. And the way the question was phrased was very precise. Okay? Please think about people you were in contact with yesterday, from when you woke up in the morning to the time you slept. A contact is defined as two-way conversation, being in physical presence of another person within 6 feet, or direct physical contact, such as sharing a bicycle ride or hand holding, etc. And then we asked them, how many people did you get in contact with inside your household, and how many outside of your household? And what we found was that a majority of individuals, okay, actually had avoided social contact. Okay. Let me show you a graph that actually describes this better than the numbers I'm presenting. Basically, about 61% of all respondents, okay, said that they had no social contacts with visitors coming to their home.
68%. This is 61.
Sorry, yes, 68% said that they had no contact with visitors coming to their home. 53% said that they had no contact with people outside of their home. Okay. And the number of people who had contact with 2 or more people tends to get smaller and smaller. But what is important is that there is this very small tail at the end. 5.6% of the respondents, okay, roughly about 100 respondents in our sample of 1700 who had a contact with more than 10 people. This is the group that we need to think about and focus on. Many of them are essential workers. Some of them are social workers. Some of them are medical workers. Some of them are shopkeepers. Okay? These people continue in tasks that are important to us, and nonetheless, they themselves are at risk by coming into contact with a multiple number of people, and they are at the risk of spreading these diseases. So how we find ways of protecting these essential workers is something that we are going to have to think about. But at the same time, we can take pride in the fact that more than half of our sample had absolutely no contact with anyone outside of their household or outside of their family. This is very impressive at a time when India, being the social country it is, social contact is sort of the blood of our life, and being able to avoid it and choosing to avoid it is quite impressive, and a success of the communication strategies that have been adopted. Our final question was, okay, given the difficulties that people are facing, what is their sense about what would their support be about extending the lockdown period if it was needed? And the exact question was, in order to limit the spread of coronavirus, if the lockdown phase is extended for another 2 weeks after April 14, would you support or oppose that? And what we found was that 64% strongly support it, 24% support it at a more moderate level, and the people who oppose it is a very, very small number. 3% oppose it, almost nobody strongly opposes it, and about 5% said it would depend on the circumstances at that point in time. So let me summarize with the lessons from the DCVTS. The first thing I would like to start with is that the government deserves great applause for acting early. India started its lockdown and social distancing at a time when relatively few cases had been identified. And it has been highly successful in sort of communicating some of the issues around it so that the people are with the government. Okay, and there has been a great strategy, success of communication strategy. We also think, though, there are some low-hanging fruits to which there should be greater attention. We may need to refine it as we move forward, particularly in identifying specific conditions and when the help should be sought, where can it be available from, and so on. So there is much work to be done. And yet, we need to appreciate the fact that there has been a great deal of success in the initial strategy. Second thing we are going to have to focus is on protecting the vulnerable. We are all in this together. Disease doesn't know the boundaries of the rich or the poor, but the poor have very more difficult time maintaining some of the restrictions that we expect in order to reduce the spread of the virus. Hence, social safety nets will have to be put in place for their protection and the protection of people who do not need the same level of social support. So again, we are all in this together. A large number of households have reported income losses in first 2 weeks of lockdown. Efforts have already begun to provide safety nets. They need to be effectively implemented, monitored, enhanced as needed. And this is going to be an area in which much work will need to be done. A much harder issue that is going to emerge as we go along is that supply shortages are already being felt. Okay? And my expectation is that it's possible they might get worse as time goes by, as transport workers might become affected. So in some ways, we are going to have to figure out how do we maintain transportation of goods between districts and states throughout this lockdown period. We also need to ensure that there is sufficient labor for Rabi harvest because we don't want to escape from pandemic to be affected by famine. Okay, I think that much thinking will need to be done to ensure that we are protecting the agriculture supply chains, medical services, essential service workers, and so on. And this is going to be one of the hardest things that we will have to do. And finally, there will be a time when we will start rebooting the economy. But in order to do that, we are going to have to identify the turning point. Okay? And that turning point can't be identified unless we have continual monitoring. Okay? We'll have to continue to monitor data on infections and economy. Testing has become the buzzword these days, and yes, it is very, very important. But I think that the monitoring of what's happening to economy at what point in time, where supports are needed and where some strategies need to be refined will also need to be done. And until without it, we wouldn't be able to identify the turning point. But this is the challenge before all of us. Thank you. I'm going to stop here and turn it over to my colleague, Dr. Santanu Pramanik, to talk about some of the work that has been going on in collecting the data that I just presented. Thank you.
Thank you, Sonal. I think we're keeping very good time. So I think Shantanu and Dinesh will take probably about 5 to 7 minutes each, and then we'll have enough time for answering questions. I have a number of them already. Some I have answered, which are just in terms of can we get access to this or that. But we'll take the questions then as we continue in the discussion part of our webinar today. Shantanu, please.
Yeah. Hi, good evening, everyone. So now that we cannot go to the field for data collection through face-to-face interview, I mean, what are the ways of collecting data at this time, at this crisis time, when scientific data collection is very important at this time as well. So we cannot just stop collecting data. We have to think of alternative ways of collecting data. And in that context, I mean, to natural mode of data collection, alternative mode of data collection that are available to us as the telephone and the web service. The widespread use of mobile phones in India, it offers a new opportunity to remotely conduct surveys in India in this lockdown situation. And now these days, I mean, it is hard to find a household without a mobile phone. So in that sense, the sample collected through telephone survey can still be considered as a probability sample with very little coverage error, I would say. I mean, almost all the households are now have mobile phones. So it is still a probability sample and which can be used for scientific inference from a sample to a population. And also it satisfies the need of a quick turnaround because there we can expect much more daily productivity that we have experienced in our survey, as well as the travel time, etc. are absolutely not there. But the biggest challenge is the absence of a reliable sampling frame of telephone numbers. I mean, this is a question I get to asked. I have received from almost everyone who wants to conduct a telephone survey now. I mean, this can be the first question in the FAQ of telephone surveys. I mean, when you don't have a prior contact, I mean, in our case, we had prior contact information from the households because it was part of the sample that we have been following for the last 1 year or so. But in many other cases, that may not be the case, but still there is a need. So I'll come to that, what are some of the alternative ways. And another form of survey, which is now getting more popular in India, is to use the online web surveys, which includes use of online forms on Facebook, WhatsApp, and sharing it through email ID, etc. Actually, currently, I think the University of Maryland, the joint program in survey methodology, they have launched a huge Facebook survey. In US, they already have collected data from 1 million people, I think, and they're planning to launch it in India as well. Actually, the Carnegie Mellon University's India office, they are sort of doing it with the help of the joint program of survey methodology from University of Maryland. The problem with web survey is that although the phone penetration is higher, is almost universal in India, but still the internet connectivity is not at that level. So I don't have the exact number, but I would expect about 40 to 50% max people having internet connectivity. So in that sense, the basis of probability sample that everyone in your target population would have a positive probability of being included in the sample is not satisfied. So how valid is your inference? So currently an emerging area of research in the survey methodology field is to how one can combine this probability and non-probability samples for drawing an inference, because this is definitely a very useful sample. And at this crisis situation, if we can collect data through non-probability sample, how best we can use it? That's a very important question that we all are sort of would like to have an answer. Next slide, please. Yeah, so I already can see a question on the methodology part of our study. So let me just briefly tell you how representative our sample is and how we have ensured randomness in our sample. So we started with the sample that we have started to follow in the last year, February, which is part of our Delhi metropolitan area study, which is essentially an incubator for doing all the methodological experiments that NDIC, National Data Innovation Center, has been doing for the last 1 year. And out of that sample, randomly assigned half of the households, they were assigned to a group which was supposed to receive 4 quarterly follow-up surveys, as compared to the other group which should have supposed to receive an annual sort of reference period survey. And at the end, we wanted to compare those two groups. So these quarterly households, we have followed them for 3 rounds. The 4th round was ongoing, then this crisis happened. So we used this of our quarterly sample, which was selected at the beginning using a multi-stage, 3-stage stratified cluster sampling. So it is a probability sample, and at every stage of selection, we wanted to ensure that we have random sample at every stage of selection. Selection of districts, selection of clusters. Clusters are essentially villages in rural areas and urban blocks in the urban areas. So in that sense, our sample is representative, and it's as Dr. Shah mentioned at the beginning, it's a rapid assessment. So we didn't want to extend the length of the questionnaire more than 10-12 minutes. And we have a sample of about 1750 households. We started with about 2,250, so about a response rate of 77%. Yeah, next slide. Yeah, so 77% response rate for a telephone survey, I would say that's quite good. And we didn't see any difference between the urban and rural area response rate, which is a new finding, I would say. I mean, in my experience, I have always seen urban area response rates are much lower compared to rural area. So the possible explanations behind the higher response rates are sort of, so we had prior face-to-face contact with these households, with these respondents, and we have validated phone numbers because we have been following them for the last 3-4 rounds. And also because of lockdown, of course, people are at home, they have more time. That probably explains the similar response rate between urban and rural areas. And another important thing for telephone survey is that, I mean, those who cooperate, those who participate in telephone surveys, that may also be very selective. So that can lead to a selection bias. So that's something we were also worried about. But when we compare it with the original DMAS baseline sample that was collected last year, February, using this 3-stage stratified cluster sampling method. So based on these certain covariates that we have looked at, because we have data from this Delhi metropolitan area study. These data we haven't collected from this telephone survey, okay? So when we compare that and we see that they are very similar. I mean, there might be some variables which we haven't looked at. There might be some selectivity issue, but in most variables that we have looked, one major component of selectivity is the gender of the respondent, because I mean, we have in our sample that almost, I think, more than 80% were male respondents compared to about 20% female respondents. But that's a separate issue. That's there are different reasons for that. But in terms of household characteristics, it's very similar sample. Yeah, next please. Okay, so now I just briefly mention about the alternative way of doing phone surveys when there is no such prior telephone numbers are available. So, I mean, there might be many other ways and different groups, I'm sure, working on it. But one group I know of, the researchers from Rice Institute. So they have conducted mobile phone survey for measuring social discrimination, where they have used this random digit dialing method when they didn't have a prior list of telephone numbers from prior surveys. So what they have done, they have built representative samples of adults ages between 18 and 65 by using probability weighted RDD and within household respondent selection. So in brief, what they have done, so what Department of Telecommunication does, it assigns mobile phone number companies 5-digit series to use at the beginning of the 10-digit mobile phone numbers that they can sell in a particular mobile circle. So mobile circle, I would consider that as a geographical area. Okay. So what the SARI team did, they generated a sampling frame of potentially active numbers in each mobile circle by equally dividing the number of series across the number of subscribers. So this data on number of subscribers are available from this Telecom Regulatory Authority of India. Okay, so then they add a randomly generated 5-digit number to each series to form a 10-digit mobile number. So the reason I'm just focusing on this slide is that because I know that many people want to do telephone survey, but they don't have a sort of clear answer how to do it when they don't have a prior contact information to them. Yes. Next slide. Yeah. So now, what is our plan going forward? So we want to study short and longer term impact of the coronavirus pandemic. So in terms of studying the short-term impact, what we plan is we plan to repeat this survey every 2-3 weeks with a different random sample from the Delhi NCR region. So we sort of plan to use this repeated cross-sectional design, which essentially means that we'll follow the same set of clusters, that is the same set of villages and urban blocks, but we'll select a new set of random set of households in each round. So what it does, it's sort of because of this type of knowledge, attitude, practice type of surveys, there's always a chance of noticing an observer effect when you follow the same households again and again. So this would preclude the possibility of this Hawthorne effect, which is very common in any impact evaluation sort of literature. And also it would reduce respondent burden. So, and at the same time, this is again a representative sample of the NCR region. So we'll get to track over time, but without introducing biases in our sample. And the second round is planned for sometime towards the end of April, so that we have a report ready before 3-4 days prior to the second lockdown gets over. And at the same time, given that we would be able to visit the households face to face to collect detailed data, and that would help us to study the impact of coronavirus on health outcomes and expenditures, and also it would help to study the impact of lockdown on financial status of households. So that's sort of a mid-term or rather long-term plan we have. Yeah, next slide. Yeah, I think so. Now I would hand it over to Dinesh to sort of share his experience of managing this survey.
And Dinesh, before you speak, just wanted to say that what's really exciting about this work is not just the speed with which it's been done, which of course is, I think, very good, but also that we are able to time the results. So, for example, the results were released yesterday or day before. They were really in circulation for a couple of days. And it's very good that these results have found evidence for the actions that were taken today, for example. And again, as Shantanu just said, we'll be able to do the next round, hopefully, well in time before the 3rd of May, which is when the current lockdown will end. And also what's important is that we'll be able to add in questions or amend questions based on the priorities that are emerging in this very period, so that this is really a real-time survey in many ways. Dinesh ji.
So, thank you, sir, and good evening to all of you. Since I am well versed in Hindi than the English, so I would love to speak in Hindi. So, when we जब हमने डिसाइड किया था कि हम ये DCVTS शुरू करेंगे, तो इनिशियली डिसीजन के बाद हमने क्वेश्चनर पे काम शुरू कर दिया था. मैम नेक्स्ट. तो क्वेश्चनर डिजाइनिंग में हम लोग ने ध्यान रखा कि सिंस ये टेलीफोनिक सर्वे होने वाला है, इसलिए हम क्वेश्चनर का लेंथ छोटा रखें, क्वेश्चंस को छोटा रखें और वर्ड्स एकदम सिंपल रखें, सो दैट हम टेलीफोन के माध्यम से अपने रेस्पोंडेंट्स तक वही बात पहुंचा पाएं जो कि हमने इनिशियली हमने सोची थी कि हमें क्या पूछना है. तो उसके लिए हमने ये सब चीजों का ध्यान दिया. इसके बाद इस क्वेश्चनर का इन हाउस हमने प्रोग्रामिंग कराया. हमारे कलीग हैं, उन्होंने प्रोग्राम किया, और जो कि एक ओपन सोर्स सर्वे सॉफ्टवेयर है लाइन सर्वे, जिस पे कि इसको प्रोग्राम किया गया था. और प्रोग्रामिंग के बाद इस क्वेश्चनर की ठीक से प्री टेस्टिंग करी गई थी. प्री टेस्टिंग हमने दोनों लेवल पे करी थी. हमारे जो फील्ड स्टाफ हैं, इंटरव्यूअर्स हैं, मींस जो सुपरवाइजर्स हैं, उनसे भी एक्चुअल सेटअप में हमने प्री टेस्ट कराया था. इसके अलावा हमारे NCAER के जो कलीग्स हैं, जो टीम मेंबर्स हैं, उन्होंने भी उसको ठीक वैसे ही प्री टेस्ट किया था जैसे कि हम एक्चुअल फील्ड में सर्वे करते हैं. नेक्स्ट. इसके बाद ट्रेनिंग करना थोड़ा मुश्किल था, क्योंकि इन पर्सन ट्रेनिंग तो पॉसिबल है नहीं. सारे हमारे इंटरव्यूअर्स सब जगह थे, अपने अपने घरों में हैं और लॉकडाउन चल रहा था. तो इसके लिए हम लोग ने ऑनलाइन ट्रेनिंग सेशन किए अलग अलग टीम्स के लिए, टीम्स में बांट के इंटरव्यूअर्स को, जो कि जूम प्लेटफॉर्म पे किए गए थे. और उसमें हमने क्वेश्चनर के साथ साथ और टेक्निकल जो एस्पेक्ट जो डेटा एंट्री प्रोग्राम की, उनकी भी ट्रेनिंग दी थी कि उनको कैसे, आपको सर्वे फॉर्म को आपको कैसे हैंडल करना है. तो ये दो टाइप की ट्रेनिंग थी. पहला तो ये था कि क्वेश्चनर का ट्रेनिंग, और दूसरा ट्रेनिंग जो सॉफ्टवेयर था उसका हमने किया. लेकिन उसके पहले चूंकि हमारे बहुत से इंटरव्यूअर्स ऐसे थे जो कि टेक्नोलॉजिकल एस्पेक्ट में बहुत वेल वरिष्ठ नहीं थे, आल्दो सबके पास स्मार्टफोन्स थे, लेकिन सबको जूम यूज करनी आता था. तो उसके पहले हमारे ऑफिस स्टाफ ने उनको एडवांस में जूम प्लेटफॉर्म कैसे यूज करते हैं, क्या करते हैं, उसकी ट्रेनिंग भी हमने सेशंस ऑर्गेनाइज किए हुए थे. और हमने इंटरव्यूअर्स को इंटीमेट किया था, सिंस हमने कहा था कि उन्हीं के फोन से हम सर्वे करा रहे थे और उसी फोन पे ही डेटा एंट्री की जानी थी लाइन सर्वे पे. तो इसलिए हमने उनको हेडफोन यूज करने के लिए बोला, साथ साथ वो क्वेश्चन करें, साथ साथ वो अपने सर्वे के जो रिस्पॉन्सेज हैं तो एट द सेम टाइम उनको वो फिल करने के लिए बोला था. अगर फील्ड स्टाफ को कोई भी डाउट्स थे, तो उसके लिए हमने एक कॉमन व्हाट्सएप ग्रुप बनाया हुआ था, जिसपे कि वो अपना क्वेश्चन पोस्ट कर सकते थे और इधर से हम लोग उसको आंसर करते थे, सो दैट सारे टीम मेंबर्स को एक इंटीमेशन जो है वो यूनिफॉर्म नहीं रहे, एक जैसा आंसर जाए और सब एक ही पेज पे रखें किसी भी क्वेश्चन में. नेक्स्ट. इसके बाद सैंपल मैनेजमेंट, जो कि थोड़ा सा टफ पार्ट था. हमने सैंपल आईडी को ऑनलाइन ट्रांसफर किया है इंटरव्यूअर्स की ईमेल आईडी पे डेली बेसिस पे. एक बार एलोकेशन के बाद उसका मैनेजमेंट भी किया. अगर कोई इंटरव्यूअर कनेक्टिविटी इशू फेस कर पा रहा था और उतने सर्वेज नहीं कर पाया, उतने इंटरव्यूज नहीं कर पाया, तो उनका हम ट्रैक करते थे और उसके बाद उन सैंपल्स को दूसरे इंटरव्यूअर को ट्रांसफर कराना और सारे सैंपल आईडीज का अकाउंटिंग रखना कि कौन सा हो गया है, कौन सा बकाया है, और लोगों को बोल के कि अभी आपके प्लेट में ये इंटरव्यूज हैं जो कि आपको फिनिश करने हैं. तो क्लोज मॉनिटरिंग करके सैंपल मैनेजमेंट हम लोग ने देखा. और इसके अलावा सब्जेक्ट रिलेटेड अगर उनकी कोई क्वेरी आती थी, क्वेश्चन से रिलेटेड कोई क्वेरीज है, या फिर कोई टेक्निकल क्वेरी अगर उनकी आती थी, रिज्यूम कैसे करना है या इसको अपॉइंटमेंट लेके कैसे क्लोज करना है, दोबारा से कब करना है, तो उसके लिए हमारे यहाँ स्टाफ था, डेजिग्नेटेड स्टाफ था, जिन्होंने उनको सारे इंटरव्यूअर्स को देन एंड देयर सेटिस्फाई किया उनकी क्वेरीज को. नेक्स्ट. सो फॉर क्वालिटी कंट्रोल ये थोड़ा सा चैलेंजिंग था और हम लोग भी बहुत सेटिस्फाइड नहीं थे, लेकिन ये बेस्ट था जो हम कर सकते थे और जो हम कर पाए। सो बेसिकली हमने क्या किया था कि हर इंटरव्यूअर को एक रिकॉर्ड, एक पर्टिकुलर टेम्पलेट में जितने भी उन्होंने कॉल किए हैं वो सारे के सारे कॉल का एक रिकॉर्ड रखने के लिए बोला था कि आप जिसको भी कॉल करते हैं उसका क्या रिजल्ट हुआ वो सब आप लिख के रखिए, और एट द एंड ऑफ द डे उसकी फोटो वो हमें यहाँ पे हमारी ऑडिट टीम को भेजते थे। इसके अलावा उनका जो मोबाइल का कॉल रिकॉर्ड्स था, सारे इंटरव्यू जो भी उन्होंने किए हैं वो सक्सेसफुल रहे हों, अनसक्सेसफुल रहे हों, पिक की हुई हो कॉल, ना पिक की हुई हो कॉल, उन सब के लिए हमने बोला था कि आप उसका भी हमें सारे के सारे स्क्रीनशॉट भेजिए जो भी आपने कॉल किए हुए हैं, और फिर हमने उन दोनों को मिलाया। तो एक तो ये वन टीयर हो गया उनके तरफ से, हमारे यहाँ जो एनसीआर के डेजिग्नेटेड मॉनिटर्स थे और सम सर्टेन इंटरव्यूअर्स को वो डेली उस पर फॉलो करते थे, उनसे रिकॉर्ड मंगाते थे। फिर सेकंड स्टेज पे हमने ये जो डेटा हमें इंटरव्यूअर से मिला था उसको हमने लाइन सर्वे का जो डेटा था उससे भी मैच किया हुआ है। और हालांकि ये बहुत फैंसी वे नहीं है मॉनिटरिंग का, लेकिन ये ही था एक ऑप्शन जो कि हम कर सकते थे। ये बेस्ट ऑप्शन हमें यही लगा। हमारे पास इतना टाइम भी नहीं था कि हम लाइन सर्वे में फर्दर डायग्नोज करके और प्रॉपर उसको इतने शॉर्ट टाइम पीरियड में ये सारी चीजें एक साथ कर पाते। और दूसरा ये था कि लाइन सर्वे के कुछ फीचर्स भी हैं, सिंस हम लोगों ने भी इसको पहली बार यूज किया और एक शॉर्ट टाइम के अंदर ही उसको यूज किया है, तो उसके कुछ फीचर्स हैं जो एडिक्वेट नहीं है, बेसिकली उन फीचर्स की और जरूरत है। तो इसलिए हमने ये जो कॉल डिटेल मंगाया और इंटरव्यूअर का टेम्पलेट मंगाया, कॉल हिस्ट्री मंगाई, इसके माध्यम से हमने क्वालिटी कंट्रोल की मॉनिटरिंग की है। और ये एक हिसाब से सर्वे का प्रूफ होता था कि आपने किस सर्वे में कितना टाइम लिया है, कितने मिनट आपकी बात हुई है, क्या किया है, कितने आपने कॉल अटेम्प्ट किए हैं फॉर ए अनसक्सेसफुल इंटरव्यू, वो सारी चीजें हमारे पास रिकॉर्ड आता था। और उसके बाद हम वेरीफाई करते थे सेकेंड लेवल पे लाइन सर्वे के डेटा के साथ। इसके बाद जिस किसी इंटरव्यूअर के साथ जो भी फीडबैक आता था वो इमीडिएटली इंटरव्यूअर के साथ हम फीडबैक शेयर करते थे। नेक्स्ट। तो इसके बाद सॉरी सर, दिस इज द लास्ट स्लाइड, आई होप सेकेंड लास्ट स्लाइड, आई विल फिनिश देयर। तो ये डेटा क्लीनिंग एंड प्रोसेसिंग। तो डेटा को जैसे ही हमारे पास आए हमने तुरंत डेटा को देखा और उसमें जो भी इनकंसिस्टेंसी हमें लगी, ऑड वैल्यू जो लगे, जैसे किसी का आ गया कि आउटसाइड हाउस होल्ड कॉन्टेक्ट 800 या 1000 लोगों से किया, तो हमें ऑड वैल्यू लगी, तो हमने इंटरव्यूअर को इमीडिएटली कॉल किया कि भाई ये 1000 लोगों से कहाँ मिली। फिर वो वहां से बताए हमको कि भाई ये वो खाना डिस्ट्रीब्यूट करने का काम करते हैं, किसी एनजीओ में लगे हुए हैं और ये लोगों को खाना डिस्ट्रीब्यूट करने का काम करते हैं, और वहां पर सोशल डिस्टेंसिंग इतनी मेंटेन नहीं हो पा रही प्रॉपर, इसलिए वो नंबर्स ऐसे आ रहे थे। जो भी ऑड वैल्यूज आए थे हमारे सर्वे में उनको हमने चेक किया, कोई बैंक वर्कर्स थे, कोई हॉस्पिटल स्टाफ था, तो इस कारण से जो भी ऐसे आए थे उसको हमने ठीक किया। और उसके बाद हमारे पास जो अदर्स ऑप्शन थे उनको हमने रिकॉर्ड किया। 2 क्वेश्चंस हमारे थे जिसमें अदर्स ऑप्शन थे, उनकी रिकॉर्डिंग की, और इसके बाद हमने डेटा को और जो नए कोड्स इमर्ज हुए थे जिनमें सिग्निफिकेंट परसेंटेज जा रहा था वो हमने नए कोड बनाए। नेक्स्ट। द प्रीवियस वन मैम, द प्रीवियस वन, yeah. So we also faced some challenges basically। इंटरव्यूअर्स का जो ये सब ऑनलाइन सर्वे फॉर्म है उसका लिमिटेड नॉलेज था और स्किल का थोड़ा सा लेस था। इंटरनेट कनेक्टिविटी का हमें इशू दोनों ही लेवल पे हुआ। जब हम ट्रेनिंग कर रहे थे ड्यू टू कनेक्टिविटी इश्यूज, कुछ इंटरव्यूअर थे जो कि ठीक से हमें सुन नहीं पा रहे थे जो भी हम यहाँ से बोल रहे थे। इसके अलावा जब इंटरव्यूअर्स रेस्पोंडेंट को कॉल कर रहे थे उस समय कई बार प्रोग्राम हैंग हो जाता था, वेट करना पड़ता था, या क्लियर वॉइस नहीं आती तो इंटरव्यूअर को बार बार क्वेश्चन को रिपीट करना पड़ता था, वो मैसेज उनको ठीक से नहीं पहुंचा पा रहे थे। और कई बार ये हुआ कि हमारा बीच में कॉल ड्रॉप हो गया और उसके बाद फिर वो हमारा नॉन रिस्पॉन्सिव हो गया, उसको हम दोबारा से इंटरव्यू नहीं कर पाए। आई थिंक द नेक्स्ट।
Great. Thank you, Dinesh. These are the team members who have, of course, been, as Sonalde Desai said, critical to the success of this work. We've also had some outside advisors whose names are mentioned there, uh, whom I'd also like to thank for their timely help and timely work. This project is funded by the Gates Foundation, and we are, of course, very grateful to them for allowing us the flexibility to change gears so quickly. Uh, Allowing is hardly the word. They've actually encouraged us to do it, so we're grateful to them. I think this has been, we're into an hour, so we have half an hour for questions that we can take up. Um, the panel is seeing the questions, but if I could, I will probably pick on a few that perhaps have not yet been answered. Some of those have already been answered. Um, I- Sonal, would you like to also just go ahead and pick a few that you would like to answer? I don't want to be curating this too much, but if you want to pick, otherwise I'll pick.
Sure. Um, there are a number of questions that are sort of focused around substantive issues and the challenges that one would be looking at as going ahead. And there are a number of questions around sort of management of survey and carrying out the survey. So let me first pick some of the more substantive questions, and then we can kind of move towards more technical ones. Okay. Um, Sudipta Mundal has a very interesting question where he asked that it's an excellent, timely survey. Congratulations to the whole team. Were the respondents who have lost income asked about their views on possible means of income support by the government? This is an area where we did not do, this was, the survey was designed so rapidly that we were sort of trying to capture the disease prevalence, people's sense about symptoms and so on. We did not pay sufficient attention to the safety nets and some of the actions that government was taking. This should be something that we would look at in the future rounds as sort of some of the more policies begin to evolve. Thank you. Shekhar, do you have any, you want to sort of?
Yes, so on the question where you commented on the communication strategy, question about what you included in the communication strategy. And I should mention that if people are interested, they can write to Shantanu at his email address, and we'd be happy to share the questionnaire as well. And at some point, it is possible that we will also make the data available to other researchers. We believe in the openness of data, and the more data we have and more people looking at it, I think we come up with much better decisions in terms of what our policies are. So the question about the communication strategies.
Santanu, do you want to take this?
So the question was, what did you include in the communication strategy?
We actually did not have a specific question about communication strategy. We are inferring, making inferences about communication strategies based on what people knew and what they believed. Okay, that's where we were.
Okay, very interesting question on the issue of 95% of the sample thinks coronavirus is a highly dangerous disease, infection. COVID-19 is the disease. Yet, a large percentage, I think if I recall correctly, 65% say they are unlikely to get infected themselves. And the question was, did you probe why people thought they wouldn't get infected? I think it's a very interesting question, but I do know that you didn't probe that. What it does, however, suggest to us is that though there is broad perception of the danger if you do get infected, there is the standard approach of denial that it can't happen to me. And that's possibly a pointer to the kind of communication that still needs to be done. That there's a pretty good chance that you could get infected if you come in contact with a person with that infection. So I think there's a second stage communication strategy that probably needs to be pursued, and that then would help us perhaps get to a smaller gap between, and people call this a denial gap, where you deny yourself that you could get affected. So that may be a very interesting point for us to consider in the next round.
Part of it also is that the timing of the survey, which was April 3 to 6, this was just the time when sort of recorded cases, the numbers were increasing. And many of the respondents that we spoke to did not have a direct contact with or even lived in neighborhoods where somebody was infected. One of the most interesting response that was coming through when some of the pre-testing was being done was that rural residents will tell you, ये तो शहर की बीमारी है, हमारे यहाँ नहीं होती है. Okay? So in the sense that they didn't see quite as something that would permeate their communities. I think perhaps we may see smaller gap as we go along and there is greater progression of the disease.
Okay. Karan Nagpal has a set of technical questions, also compliments the team on executing a survey so fast. You've already answered that the surveys were about 10 to 11 minutes in length on average. So the first question was, how long were the surveys on average? And the second is, the questions are phrased very precisely and use Likert scale type response options, which are usually hard to implement during in-person surveys. How easy or hard was it to explain these choices over the phone? And then the final question is, what was the gender split of the respondents?
Santanu, do you want to take it?
Sorry. Yeah, the gender split is, as I said, it's heavily skewed towards male respondents. So we have about 83% male respondents and 17% female respondents. And I mean, what we have seen, so this was like whoever picks up the phone, we talk to that person. There was no no additional thought was given how we can incorporate more female respondents in our survey. But we have...
Sorry, just to interject. You tried to speak to the head of the household, certainly an adult, right? So it wasn't just whoever picked up the phone.
It's an adult, but
Yes.
basically, in most cases, it would be whoever who was our DMAS respondent and shared their phone number. So the call will go to them and
Sure.
we check the age, and then if it's an adult. But what we have seen in another telephone survey of employment survey, where we have specifically included one male and one female respondent from each household. But there also the proxy response for female respondents are quite high. About 40%, I would say, proxy responses. I mean, whoever the gatekeeper of the household sort of picks up the phone and won't let you talk to the female respondent, even if you want to. So I don't know how much we can control this in the next round, but that's the scenario we have experienced.
A question about whether this is going to be the new normal for survey work, given the speed with which one can do this and a number of other factors, the response rate also being reasonably high, the rural-urban response rate being similar. So a question about whether this is going to be much more in use, certainly in the center that you are a part of at NCER.
That's too early to comment, but see, if you think of this coronavirus telephone survey and some other surveys we are thinking of conducting, or we have done conducting using telephone survey, are all very short survey. And the questions are very simple. I mean, that doesn't involve too much calculation, too much complexity, like sources of income from different sources, health expenditure from multiple episodes of hospitalization or outpatient illnesses, etc. Those we are not sure yet whether it will be feasible to collect those complex information using telephone survey or not. But of course, if it's a short, relatively shorter survey with simpler questions, it's definitely a way to go.
A lot of suggestions here, and we will capture these questions, and the team will have an opportunity, since we know who the person is asking the question, to respond to some of these. There are a lot of suggestions here that I see for the next round of the survey, which I think are incredibly useful And they talk about a number of different things, a lot on the communication strategy, and also to some extent to probe more on that. Was it the communication strategy or the very strong, I don't, there's a Hindi word which of course describes it the best, the bandobast that was done with the police presence, the barricades, the checking, the messaging on your cell phone. Was it that, or was it the communication strategy, or in some sense the bandobast becomes part of the communication strategy? So that may be something that might be worth pursuing. I think there's a lot of questions here again about the methodology. Those have been answered very well by Dinesh in his detailed description of the care with which this survey was done. I have to say that these people hardly slept for a week or so before the survey because there was such intense testing and such intense work that was involved. And what's remarkable is that they trained the interviewers as well completely online. So this was a 100% digital operation. The survey results, by the way, this presentation as well as the webinar itself will be on YouTube. So if you wish to go back to it and look at it, and as I said, the presentation itself will be available on NCR's website. I think it's already there and was already linked, I think, in the invitation to which people have responded. Yes, Dinesh, you wanted to say something.
Yeah, so for no difference in rural and urban areas, I would like to add that since we were visiting those households regularly in each quarter, so they know us well and they recognize that we are the people who used to visit them, and that's why they answer. Another reason may be this lockdown. Everybody is at home waiting for phone calls. So,
Mm-hmm, mm-hmm. A question here about whether you would be able to probe domestic violence. There is every expectation and considerable evidence that domestic violence has increased as a result of the lockdown, and a suggestion that you might want to consider probing that because that's obviously a very important, unexpected, or maybe even expected side effect of the lockdown. I don't think I know the team discussed it, but felt that in this first round it would be too much to take on. But I know it's on your menu of things to be thinking about.
Yes.
The question, I guess, which is probably the answer is yes, Dr. Pankaj Sharma, will the same questionnaire be used in the next round of survey, or you will replace it with a new one? I should mention, and I guess you mentioned it, but it's worth reiterating, that actually the team has almost a year of information about these households. They're part of a panel. So that actually there's a lot of detailed information about educational backgrounds, about a whole range of other areas. Of course, it's not been possible to go back and parse that data and analyze it in ways in which this data could be analyzed later on with sufficient anonymization as well. So there are questions about mental health that I think are worth pursuing, since that's going to be important. That's related to the domestic violence question. Question about you've mentioned that you see no rich-poor differences and no rural-urban differences. I think we do see a rich-poor difference, so that's not yet been analyzed, right, Sonal?
I think that we don't see them in certain things, such as the knowledge. We didn't see a huge difference. We do see pretty big difference in the income effects and so on. So it depends on the outcome that you are looking at.
And in terms of gender differences, we did not go into those in this particular first round, did we?
No, we did not. We largely because of the sample selectivity in terms of who our respondents were and the small number of female sample. But I think that there may be other types of gender differences that are worth analyzing as we go along with the data itself. We have quite a bit of information. So what kind of gender differences do we expect? Okay, we expect gender differences in people's knowledge and attitudes. we also expect to see gender differences in households which have had particular kind of gender patterns in the past and how they are sort of reacting to it. Okay, so for example, households where large number of women have been employed in informal sector may be seeing a greater income shock than households where women have not been in the informal sector work, where women have been working in farming. So on those we have data. So I think that we should be thinking in terms of two types of gender, actually three types of gender effects. One is households differ in their basic structure in the way gender norms are applied, work patterns are set up, types of lifestyles that people live. For example, some households rely on LPG gas and others rely on women collecting biofuel and firewood. Okay. Those households will differ in the way they are able to sort of experience social distance and so on. Second is that men and women may have very different response to the risks, knowledge, behaviors. And the third one is actually that the event is affecting everybody in the same way, but its effects are felt by women very differently than by men, as you mentioned, sort of the issues of domestic violence. Okay? And I think there is certain things that we can do with existing data, which we haven't had time to do, to be honest, because the data collection just got over less than 10 days ago. Okay, certain things we would hope to collect as we go along. And certain things may require a much more in-depth study than we are able to do on a telephone interview. Long answer, I'm sorry.
No, I think it's very good.
So
Shantanu, you have something more to add to that?
yeah, no,
I have
so
an
I can.
important question coming up. Yeah.
Okay, so let me just pick a couple of questions. I just have a random start from some.
Can I just put my question first?
Yeah, please.
It's a
Yes.
practical question that was posed by a senior civil servant to me when they looked at this. And they said, how can our survey help in addressing questions which are quite complex, but which are really at the heart of the problem that the government is grappling with? For example, lockdowns. Lockdowns can be by geographic area. So you have, a case or two or three or four in a particular area, and then that entire housing colony, that area is locked down. That's a kind of very standard, easy to enforce, and people can comply with it easily because you literally have a physical lockdown of an area. It could be a large area, a small area. There is a risk-based containment strategy, which requires, of course, much more intense testing, being able to identify clusters or above 65 age people or some other, hypertense population, diabetic population. All of these are massive risk factors for COVID-19. So in that situation, you're using a much smarter isolation strategy based on intensive testing. Now, it would be very useful for decision makers if they knew some sense of how households will respond to one or the other. If a case was found in your area, would you be comfortable with the entire area cordoned off? Or would you rather that the adults or the elderly in your household are tested in a sense, so as to, because they are at the greatest risk? These are difficult to put out in a simple questionnaire, and particularly a telephone questionnaire. But that seems to be the challenge, because these are the complex ethical, moral, practical questions that some of the decision makers are dealing with. So maybe a conversation with some of these groups to be able to identify 4 or 5 key such issues, which you can then try to unbundle into simple questions, which when put together can give us some answers. I know this is I've described a very complex process, but this is some of the issues that people are dealing with.
Shekhar, that's a really fascinating comment. And I think it highlights clearly where the policy needs are. We have been thinking a little bit about it. And we think that to some extent, because we have a geographically clustered sampling, One of the questions that is really worth looking at is whether there is a correlation in the responses between the people who are living within a cluster versus sort of between the clusters. And then in future actually collect some data on what are these clusters characteristics. Has their lockdown been, have cases been detected in this particular cluster? Have they been identified as certain kinds of hotspots? So that's one part of it. The second part of it is actually because we are very fortunate that we have tremendous amount of health history for these households to see if the responses of individuals on the risk perception behaviors vary by the household members who may be diabetic, by people who you may be living with who have cardiac conditions and so on. So one is sort of going forward into future analysis, data collection. The other is actually looking back and analyzing the existing data. Okay.
That would be fascinating. That would be really fascinating if we were able to do that. And because of the very fortunate position you find yourselves in with all the panel data that you have about the households, this could be a tremendously rich way of looking back. Of course, time is of the essence. We kind of, this virus is not stopping for us. So I know there's probably going to mean a lot more sleepless nights staring at screens. But yes, would be very timely. Shantanu, I interrupted you.
Yeah, no, I think that's really very important point you raised. So I just was going over some of the questions. Let me answer some of them. It will be difficult to answer like 77 questions.
I just want to just take a time check. It's 1 hour, 21 minutes into our webinar. We should end promptly. People have lots of other things to do, including looking after people in the house and all kinds of housekeeping stuff. So let's end in about 9 minutes. Shantanu.
Yes, sure. So, question from Abhishek Hajra, what percentage of phone numbers are non-reachable or non-functional? So that was not a problem for us because we have validated phone numbers. So sometimes probably they didn't pick up or they disconnect, but it was not the case of non-functional phone. Question from Neha about over subsequent rounds, do you plan to collect information on safety nets? Yes, because I mean, since now we know that 80%, vast majority of the households are affected. They have experienced income or wage loss. So it is important to collect data on safety net, what they received, what they think should be provided to them, etc. And question from Madhu, did you talk to the same household member as earlier? We haven't tried to sort of match that with our earlier data. Yes, did the interviewer use their own cell phones? Yes, they have used their own smartphone. We have provided them data recharge to all the interviewers, but they have used their own phone. Yeah.
I have a question about whether we can probe more on the entitlements or what people feel they can actually get from social safety nets that everybody is racing to try to design, whether it's a cash payment or whether it's additional rations or through the PDS. So some form of the preferences for safety nets, the question there about that. Any thoughts on that, Sonal?
I think it's a good point. We consistently struggle with how many questions and how to phrase them, and are we getting are our respondents actually understanding what we are asking? But I think that safety nets is clearly going to be something that we would need to think about in future.
Question here about the support for a lockdown. Were you able to parse that by the type of worker, salaried, informal, unorganized sector, other? So could I don't think you've done that, or if you have, we haven't yet released that.
Santanu has done an interesting analysis. I'll let him answer it.
Yeah, so what we have done, we haven't done the occupation wise exactly, but what we have done, like households who experienced income reduction versus household who did not experience income reduction. So in terms of support, there is no change, but in terms of oppose where we have seen that households who did not experience income reduction, who experienced income reduction very much, they are opposing more to the, although the percentages are low, it's about 5.6% versus 1.3%, like who did not experience income reduction to a large extent, they are not opposing, whereas who experienced it to a large extent, they are opposing more. So that's one.
But still, it's very small number.
It's a very small number because of support for lockdown was almost universal. Yeah.
Okay. We have a few more minutes before we close. Um, did you consider web-based surveys and what might have been the potential handicaps at the respondent end? Had you thought about that? That is smartphone-based questionnaires.
Go ahead, Sonal. Yeah.
We have been thinking about experimenting with web-based surveys. There are some fairly interesting ways of drawing samples of web-based surveys. And I think that this is an area in which NDIC should be looking into future. The problem is, I think, that at this point in time, what is more important is a representative sample. And confidence in data is very important as, we are dealing with an emergency situation. Okay. And we felt that this was not the right time for an experimental design where you are sort of drawing samples which may not be representative. Even with our sample, we are worrying about the fact that, oh, maybe we are missing out some of the people who are really affected by migration. Okay. And so this was something that I believe is going to be the wave of the future. I believe this is where NDIC should be experimenting. And at the moment, we have not done it.
Okay, we'll take two last questions. A fascinating question from Ritvik Kindra. Would it be worth capturing how the sample feels about the return to normalcy? So suppose if the lockdown was lifted tomorrow, how would they venture forth? Would they go out in the streets and celebrate, or is it going to be a huge reluctance, as many people around the world believe, that there's not going to be this great splurge of consumer demand because actually people are going to still be very scared? So just understanding what happens the day after and what are people's perceptions about that. Sonal, Shanti.
Ritvik, this is a fantastic question. We actually are hoping, we have quarterly surveys of the disease DMAS sample that are being undertaken, where we can actually track their expenditure patterns, their incomes, and health expenditure, health status, etc. We had just started our quarterly survey when we were interrupted by coronavirus. So our hope is that the moment it ends, we will be back into the field with a more face-to-face survey, where we'll actually be able to probe into some of these questions in greater detail and with greater confidence. We may need to redesign some of our questions to capture this intervening event, but very few people are fortunate to have a before and after sample, which was sort of interrupted through such
Exogenous event.
Unfortunate situation. I
But also exogenous.
I sort of feel like I'm howl when I'm trying to sort of talk about this, because in some sense, I'm excited about the opportunity of collecting before and after data. And yet the situation we are dealing with is about the most unfortunate situation we could have imagined. Okay.
I think the one point of the question also is, this is what you've answered is fascinating, but it's also important to know possible patterns of behavior if and when the lockdown is lifted. And that would condition decisions about how the lockdown should be lifted, gradual, cold turkey. So in some sense, we ought to probably know a little bit more about how preferences might pan out and how people's behavioral responses will be the day after or the day the lockdown is lifted. And the last question is about testing. Arpita Ghosh asking, in your next survey, would you capture awareness about testing? For example, would households voluntarily go for testing? Should there be some kind of a signal? Somebody suggested to me that just as we carry the election mark on our finger, which is indelible for several weeks, should we be allowing people to get tested and they test negative with a RT-PCR test, which would be the only way of sort of testing that they are negative, then should they have that mark? And then, in some sense, does that provide an incentive to be tested? So this whole issue of testing, which is at the heart of the data that we need to be able to segregate and cluster at risk and at low relative risk populations.
Very interesting question, and I suspect human rights activists will be debating it for a while. At what point are our health status meant to be revealed and open? Where does the right of the society to prevent infection supersede the right of the individual to the privacy and non-discrimination? Interesting question.
Yeah. Okay. Well, we're at the end of this webinar. I'd like to thank all our participants who joined us. We had close to 170 people as attending this webinar. As I said, this is the second of our webinars. I do want to announce there will be one tomorrow. Notice is going out very shortly. I don't have all the details, so we will, but that will focus on the second part of the scale that Sonalde Desai showed in one of her slides, the economy. So it's going to focus very much on where's the money coming from, what's going to be the relationship between the states and the center, and what do we need to do to be for the rich in our country to be able to part with some of their wealth, to be able to create a solidarity fund that allows us to be much more responsive to those who are in need. I don't have the details, but please watch out. If you got an invitation to this webinar, you will be getting an invitation for the next webinar as well. With that, I'd like to thank Professor Sonalde Desai, who has spoken up early this morning to be with us from the University of Maryland. Santanu Pramanik, the Deputy Director of our National Data Innovation Center, and Dr. Dinesh Tiwari, who is a key member of the NDIC team. And I'd like to thank all of you viewers for being with us. Please keep on a lookout for a series of such webinars that we will be doing in the course of the next few weeks. Thank you all for joining, and I wish you all a good evening. Bye-bye.
Thank you very much, Shekhar. Thank you for moderating this.
Thank you, sir.
Thank you, Dr. Shah.
Thank you.
Thank you, Dr. Sir.